No calcium in your heart arteries, so nothing to worry about? Well, not if you're younger than 45. This week, a major trial presented at the European Society of Cardiology. Now, remember, just last week, my video on 10 things most people don't know about coronary artery calcium mentioned a study years ago showing that 58% of diabetics 45 years or younger, well, they had plaque on their CT angiogram, even though they had a calcium score of 0. And now a major trial in Denmark confirmed that using a score of 0, that means no calcified plaque, as a reason not to start cholesterol-lowering therapy was a bad idea for many when they were 45 or younger. As I have said before, the accumulation of cholesterol, those first little streaks of it in the arteries, begins early in life and develops slowly, and they are usually not calcified. By the time they are, we see that calcium in older folks makes up only about 20% of their plaque. Think of it like an iceberg. You can only see 20%, that's calcium. 80% is not, and it may be too long. You should have started earlier. Now, this study looked at all ages in Denmark for people who had coronary artery calcium and had some type of heart symptom, and 84% of people 45 or younger, they had no coronary calcium, none. The take-home message here: 1, 10-year risk charts are helpful in some, but not in people you expect to live 30 or more years. We want to know what's your risk factor in 20, 30, or 40 years. 2, high cholesterol is more important risk factor in patients under the age of 45 than a 0 coronary artery calcium score. This trial used patients with some symptoms, but it's reasonable to translate to all. 3, you could use coronary artery calcium better as a one-sided test in young people, which means, hey, if you've got any calcium at 45 or younger, that's truly a significant risk factor, and then you should consider a statin. And 4, if you need a statin and you're 45 or younger, don't use a coronary artery calcium score of 0 as an excuse not to take it. You may pay for this 20 years down the line. I hope that helps.